If you take like a 600 horsepower Ferrari engine and you just drop it into this rusted out chassis with old, completely worn out brakes, you are eventually going to crash.
Oh, absolutely.
Right. It's just a matter of physics at that point. And today, we're looking at a stack of sports medicine and endocrinology papers that suggest millions of women might be doing something very similar to their bodies.
Yeah, completely by accident, too.
Exactly, by accident, every time they hit the gym or, walk into a dermatology clinic. So, welcome to today's deep dive. We have this really fascinating stack of sources in front of us today.
It's a huge variety of data, really.
It is. We're talking clinical trials on resistance training, tissue engineering papers, and even these really specific studies on laser wound healing. And our mission today is to answer a surprisingly overlooked question for you, which is, does the birth control pill affect how your body builds collagen after a treatment, an injury, or like a heavy workout?
And it is a question that forces us to rethink a massive biological blind spot. I mean, for decades, we've looked at oral contraceptives almost exclusively through this one very narrow lens of reproductive health.
Right, like managing periods, preventing pregnancy, that sort of thing.
Exactly. But the reality is that these pills, they fundamentally interrupt the body's natural hormone rhythms.
Yeah.
They take your innate, your natural fluctuating signaling network, and they replace it with a continuous flat stream of synthetic hormones.
Which changes everything.
It does. And those synthetic hormones are sending system-wide instructions that go far beyond just the ovaries.
Which brings us right back to that Ferrari analogy, because we aren't just talking about like a theoretical shift in your blood work here. We are talking about the literal scaffolding of your physical structure.
Yeah, your connective tissue.
Right. Collagen makes up your tendons, your ligaments, the fascia that's wrapping your muscles, and of course, obviously, your skin. So whether you're paying for a really high-end cosmetic laser treatment, or maybe you're recovering from plastic surgery, or even if you're simply trying to increase your squat max at the gym, this deep dive is going to look at the exact mechanisms of how synthetic hormones change your body's ability to rebuild that scaffolding.
Yeah, and to understand what happens when we intentionally damage tissue to force a repair, which is what a laser or a heavy workout does, we first have to look at the baseline.
Okay, the baseline.
Right, we have to understand what happens to your biological collagen factory the very moment you swallow that pill.
Let's start with the actual journey of the pill itself then, because I always just assumed, when you take a medication, it dissolves in your stomach and then magically just gets distributed evenly throughout your bloodstream.
A lot of people think that.
Yeah, but the sources we're looking at highlight this massive bottleneck in that process.
They do. So the bottleneck is your liver. And the mechanism for this is known as the first pass effect.
First pass effect. Okay.
Right. When you swallow an oral contraceptive, the synthetic estrogen, which is usually ethinyl estradiol, it doesn't just float freely out into your systemic circulation. It gets routed directly to the liver for chemical processing.
Oh, wow. Okay.
Yeah. And when that really heavy dose of synthetic estrogen hits the liver, it severely suppresses something called the hepatic growth hormone, IGF-1 axis.
Okay, wait. Hepatic just means liver. Right.
Yep, exactly.
But what is the IGF-1 axis actually doing in this specific context? Because I've seen IGF-1 listed on all these anti-aging forums, but how does it relate to the pill?
So IGF-1 stands for insulin-like growth factor 1. And for our purposes today, you can think of it as the ultimate project manager for tissue construction in your body.
The project manager. Got it. Yeah.
There's this really brilliant tissue engineering study from MDPI that illustrates this perfectly. The researchers looked at dermal fibroblasts.
Which are the cells that make collagen?
Right. Exactly. The specific cells responsible for manufacturing your skin's collagen. And they wanted to know what would happen if they exposed these cells to different hormonal environments. So initially, they just gave the cells estrogen and progesterone.
I would assume those cells just went to work, honestly. I mean, the prevailing wisdom in the beauty industry is that estrogen is basically the holy grail for keeping your skin plump and glowing.
Well, and the beauty industry isn't entirely wrong there. Estrogen does play a big role in skin moisture and thickness. But in this specific tissue engineering study, estrogen and progesterone alone did not significantly increase the actual deposition of new collagen matrix.
Wait, really?
Really, the cells just didn't start building. The primary driver that actually sourced those fibroblasts to lay down fresh structural collagen was IGF-1.
Oh, fascinating.
Yeah, it acted in this powerful dose-dependent manner. So when you suppress IGF-1 through that intense liver processing of the birth control pill we just talked about, you were essentially cutting the radio line from the project manager.
Oh man, so the fibroblasts are just sitting there waiting for the order to build, but the signal just never arrives.
Exactly. They never get the memo.
So, okay, the obvious workaround here seems to be the delivery method, right?
Yeah.
If the problem is swallowing the pill and forcing it through the liver's first pass processing, what happens if we use like a patch or an IUD or a vaginal ring? If we bypass the liver completely, do we save the collagen signal?
That's a great question, and a study published in Frontiers tackled that exact
Oh,
hypothesis.
perfect. What did they do?
They took healthy premenopausal women and split them into two groups. One group was taking a standard combined oral contraceptive, and the other was using a contraceptive vaginal ring.
Okay, because the ring absorbs the synthetic hormones directly into the local bloodstream, right?
Right, largely bypassing that initial heavy liver processing.
So did the ring users dodge the bullet?
Well, they maintained a slightly better IGF-1 responsiveness than the pill users did, but they still experienced a massive systemic suppression of a critical biomarker called PINP.
Okay, I'm going to need a translation on PINP. What exactly is that measuring?
Yeah, so it stands for procollagen type I N-terminal propeptide.
That is a mouthful.
It really is. But rather than getting bogged down in the chemistry of it, just think of PINP as the exhaust fume created when a cell successfully manufactures new type I collagen.
Okay, so if the factory is actively running, smoke comes out of the chimney.
Precisely. PINP is a highly reliable blood marker that tells us how much active bone and collagen formation is happening in the body at any given time. And the researchers found that PINP was suppressed by around 40% in both the pill group and the ring group.
40%. Wait, that is a massive drop in baseline construction.
It's huge.
It means that even if you bypass the liver entirely, the sheer presence of these systemic synthetic hormones in your body is just like turning the dial way down on your natural rebuilding process.
The systemic signal to build is fundamentally muted, yeah.
Wow. Okay, let's apply this to real life. Let's look at physical fitness and that whole Ferrari analogy we started with. Because if the baseline signal to build collagen is down by 40%, what happens when we intentionally force the body to adapt? Let's say you hit the gym and you start lifting really heavy weights.
So the sources outline this fascinating 10-week resistance training study that compared women on the pill to non-users.
Okay.
They put both groups through a really heavy, supervised lower extremity lifting program. We were talking intense knee extensions and leg presses that are actively designed to force adaptation.
Because whenever you lift heavy, you're creating micro tears in the muscle belly, and then the body repairs them to be larger and stronger. I'm assuming both groups built muscle.
They did. And interestingly enough, the women on the pill actually showed a trend towards slightly greater muscle mass gains, particularly in their type I muscle fibers.
Oh, wow. So the physiological engine, so to speak, got bigger.
It got bigger, yeah.
Yeah.
But the critical, honestly alarming difference was found in the tendon.
Specifically the patellar tendon, right? Like that incredibly thick, dense band of connective tissue that anchors the kneecap to the shin bone.
That's the one. So for the non-users in the study, the adaptation to the heavy lifting was beautifully balanced. Their muscles grew stronger, and their patellar tendon cross-sectional area actually physically thickened to handle the new mechanical load.
Right, so the whole system upgraded together.
Exactly. But for the women on the pill, their tendon thickness did not increase at all.
Wait, what? How is that even physically possible? You subject a tendon to 10 weeks of progressive heavy mechanical stress, and it just stays exactly the same size.
The biopsies tell the story here. When researchers examined the tendon tissue of the pill users, they found significantly higher levels of what are called HP crosslinks.
Okay, what are HP crosslinks? Like, are they a good thing or a bad thing?
Well, in this context, they represent a serious problem of stagnation. So crosslinks are just chemical bonds that form between collagen molecules to give them strength.
Nice, that sounds normal.
It is, but HP crosslinks specifically are mature age-related bonds. So when you have a high concentration of them, it indicates that the collagen turnover rate in that tissue is incredibly slow. Okay, the tendon is not clearing out old tissue and replacing it with fresh, elastic, newly formed collagen. It is just sitting there accumulating these really rigid, mature bonds.
So the tissue is essentially stagnant. It's like trying to secure a really heavy load with an old stiff rubber band instead of a fresh elastic bungee cord.
That captures the structural vulnerability perfectly.
Yeah.
Because the tendon isn't actively remodeling to match the new demands of the growing muscle, you create a severe mechanical mismatch.
And there is the Ferrari engine with the worn-out brakes. I mean, the muscle is generating way more explosive force than it ever has before, but the connective tissue tying that muscle to the bone is stuck in the past. It's entirely unupgraded.
Exactly. The theoretical risk for joint and connective tissue injury just skyrockets in this scenario.
I bet.
I mean, if you are an athlete or even just someone who pushes themselves hard in plyometrics or heavy lifting, and you are on the pill, you are putting massive loads through a chassis that simply hasn't adapted to support your new engine.
The muscle will pull, and the stagnant tendon is basically the weak link that could fail.
Yeah.
That is honestly terrifying for anyone who's just trying to build strength safely. But what about a different kind of tissue damage? Because the fitness world relies on mechanical stress, but the entire cosmetic and plastic surgery industry relies on controlled thermal or physical damage,
Right.
right?
Completely different mechanism.
Yeah, you intentionally injure the tissue to trick the body into healing itself so it looks younger.
Well, let's examine fractional CO2 lasers.
Mm.
These are incredibly popular for facial skin resurfacing to treat wrinkles or acne scars. And they're also used a lot in gynecology to treat genitourinary syndrome of menopause.
Okay.
The laser functions by firing microscopic columns of intense thermal energy deep down into the tissue.
I always picture it like aerating a lawn. Like you punch thousands of microscopic hot holes into the skin to wake up the dormant fibroblasts and force them to grow thicker, healthier grass.
That's a great visual. The clinical term for that is neocollagenesis, which just means the birth of new collagen.
Got it.
So laser triggers a massive localized wound healing cascade.
Mm-hmm.
And in a natural hormonal environment, your endogenous, naturally produced estrogen plays a really critical role in orchestrating this entire repair process.
Oh, so.
Well, natural estrogen actively suppresses an enzyme called MMP9.
Okay, I'm not familiar with MMP9. What is its job in the healing cascade?
MMP stands for matrix metalloproteinase. But you can basically envision MMP9 as the demolition crew on a construction site.
Okay.
When tissue is damaged by the laser, some demolition is absolutely necessary, right? You have to clear out the burnt, necrotic debris. But if MMP9 runs wild, the demolition crew gets overzealous and starts degrading the healthy extracellular matrix too.
Ah,
You can't build a new house if the bulldozers never leave the lot. So natural estrogen keeps MMP9 in check.
so the natural estrogen is what sends the demolition crew home when their job is actually done.
Exactly. Furthermore, natural estrogen promotes VEGF, which is vascular endothelial growth factor.
Okay, so if MMP9 is the demolition crew, what is VEGF?
VEGF is the plumbing crew. It stimulates the growth of new blood vessels, flooding the damaged area with oxygen and nutrients so the fibroblasts actually have the energy they need to build.
Wow. Okay. But when you are on the pill, your natural estrogen production is severely downregulated. You just have this low static baseline of synthetic hormone instead of your natural peaks and valleys.
Right. And because of that static synthetic baseline, you potentially lose the protective check on the MMP9 demolition crew, and you lose the boost to the VEGF plumbing crew.
Oh, that's bad.
Your fibroblasts are desperately trying to rebuild the tissue you just paid good money to laser, but they are working in a microenvironment that is severely biochemically disadvantaged.
So the final yield of new, bouncy collagen might simply not reach the level it would in a naturally cycling environment.
Exactly.
Okay, so if swallowing a synthetic pill systemically blunts our healing by messing with IGF-1 in the liver, and it keeps our natural estrogen too low to manage the healing cascade, can we just bypass the system entirely? Like, what if someone just took the hormone and applied it directly onto the wounded tissue?
That is a really interesting thought, and researchers in the journal Neuroquantology decided to test that exact concept.
Oh, really?
Yeah, they set up an experiment looking at excisional wounds in rats. They physically removed small, uniform patches of skin and treated the wounds with various therapies to see which biological environment would drive the fastest closure.
That sounds pretty brutal, but I guess very clear cut what actually worked.
The fastest wound closure by a massive margin occurred when they applied a combination of fibroblast cellular therapy along with topical progesterone.
Just right on the wound.
Right on the wound.
Yeah.
Between days 7 and 14 of the healing process, the wounds treated with the topical hormone accelerated their healing drastically compared to the untreated control groups.
So instead of a systemic pill, it's literally like putting a hormonal neosporin right on a paper cut. The local tissue is actually absorbing and using that signal on site.
Exactly.
Yeah.
And human clinical studies reflect this too. There is substantial data showing that applying topical estrogen directly to the skin of older subjects promotes rapid wound healing.
That's
It
amazing.
really is. It reduces the surface area of the wound and significantly quells local inflammation. By applying the hormone topically, you completely bypass the liver. You avoid the first pass effect, you avoid suppressing your systemic IGF-1, but you still hand the local fibroblasts the exact chemical keys they need to unlock construction.
It is wild how hyper-localized our cellular receptors can actually be. But, everything we've discussed so far really revolves around the blueprints, right? The project managers, the demolition crews. We are talking purely about signaling. What about the actual physical building blocks? Like, if the signal gets through, does the body even have the materials it needs to build?
Well, a blueprint is entirely useless if you don't have the bricks to lay the foundation. And this is perhaps the most under-discussed side effect of oral contraceptives outlined in our sources today.
Really?
Yeah, they actively, aggressively alter the body's baseline nutritional requirements.
Wow.
A comprehensive report in the European Review for Medical and Pharmacological Sciences details how processing the pill depletes the body of crucial micronutrients.
So we are talking about the basic vitamins and minerals we just get from our diet.
Yes. Specifically, processing these synthetic hormones heavily drains your reserves of vitamins B6, B12, vitamin E, and most crucially for our deep dive today, vitamin C.
Vitamin C. See, most of us just think of grabbing a glass of orange juice when we feel a cold coming on. How does it relate to connective tissue?
For collagen synthesis, vitamin C is an absolute non-negotiable cofactor. You literally cannot form healthy tissue without it.
Wow, okay.
Think about it like this. Collagen begins inside the cell as these single loose strands of protein. To become strong, those strands have to twist together into a really dense triple helix structure, much like braiding a heavy rope.
Okay, so where does the vitamin actually come in?
The cellular enzymes that twist and lock those strands together, a process called hydroxylation, they strictly require vitamin C to function.
Oh, I see.
If you are deficient in vitamin C, those enzymes fail. It's like trying to tightly braid a thick, heavy rope while your hands are covered in grease.
Oh, man.
Yeah, the strands just slip, the helix doesn't form properly, and you end up with structurally weak, defective collagen that breaks down easily.
So you could have the perfect workout or pay for the perfect laser treatment, but if the pill has drained your vitamin C, your body simply drops the tools.
Exactly, and compounding that deficiency, the pill also increases systemic oxidative stress. The sources measure this by looking at malondialdehyde levels in the blood.
Let's put that in plain English for a second.
Right.
What is malondialdehyde and why should we even care about oxidative stress?
Right, so think of oxidative stress like rust accumulating on the undercarriage of a car.
Okay.
When your cells produce energy, they naturally create reactive oxygen molecules called free radicals. That's the rust. Normally, your body produces antioxidant enzymes to scrub that rust away before it causes any damage.
Makes sense.
Malondialdehyde is simply a blood marker that proves lipid peroxidation, or rust damage, is actively happening to your cell membranes.
And the pill makes this resting process worse.
It does. Because the liver is working so incredibly hard to process the daily influx of synthetic hormones, the body's natural antioxidant defenses are heavily depleted. Pill users consistently show higher malondialdehyde levels, meaning more cellular rust, and lower antioxidant enzyme activity to fight it off.
Okay, let's connect all of this directly to you, the listener, right now. Let's say you just paid $2,000 for an aggressive, state-of-the-art laser facial. You are expecting glowing, bouncy, collagen-rich skin in about a month.
Yeah, that's the goal.
But if you are on the pill, your liver is actively muting the IGF-1 signal. Your natural estrogen isn't there to stop the MMP9 demolition crew from tearing up way too much tissue. And if you aren't heavily, deliberately supplementing vitamin C, your body is physically depleted of the primary raw material it needs to braid those collagen strands together.
Exactly.
It is quite literally like hiring a contractor for a massive kitchen renovation, handing them the blueprints, but completely forgetting to buy the lumber.
The environment you've created biologically is just working against your aesthetic or athletic goals.
Yeah.
Your body wants to heal the laser trauma or rebuild the tendon after a heavy squat, but you've tied one hand behind its back hormonally and just emptied its toolbox nutritionally.
This changes the entire conversation around recovery, so let's recap the critical takeaways for you. The birth control pill is not just a switch that pauses your reproductive cycle. It is a systemic, whole-body override. It suppresses the IGF-1 collagen signal in your liver right out of the gate. It stalls the physical growth of your tendons when you exercise, creating a highly dangerous mechanical mismatch between your growing muscle strength and your stagnant connective tissue.
Which is a huge injury risk.
Huge. It alters your cellular healing response to cosmetic and surgical treatments by changing how local enzymes degrade and rebuild tissue. And it quietly, continuously drains the vitamin C and antioxidant reserves your body desperately needs to build that connective tissue in the first place.
So the actual takeaway here is that you simply cannot operate under the assumption that your baseline is standard.
Right.
If you are going under the laser, if you are recovering from a structural surgery, whether it's an ACL repair in your knee or a rhinoplasty, or if you are ramping up your physical training to build strength and you are taking combined hormonal contraceptives, you must proactively account for this altered physiology.
So what does that look like?
Well, you likely need to adjust your recovery timelines. You may need to extend your rest periods between heavy lifting sessions just to protect those slower adapting tendons.
Yeah.
And you absolutely must aggressively target your nutrition, specifically replenishing vitamin C and antioxidants, to give your body the actual physical building blocks it is losing to the medication.
You cannot just assume the construction crew will handle it. You have to be your own project manager, and you have to supply the lumber yourself.
Exactly. And, looking at this from a macro perspective leaves us with a rather profound question to consider.
What's that?
Well, the medical community has spent the last 60-plus years heavily studying what the pill does to human fertility, blood clot risks, and mood regulation. We know the reproductive and cardiovascular effects inside and out, but considering that fibroblasts and the collagen they produce are the literal architectural foundation of our entire physical structure, from the elasticity of skin on our faces to the tensile strength of the tendons in our knees, all the way to the structural integrity of our pelvic floors.
Yeah.
We have to ask a bigger question.
Yeah.
By intentionally suppressing these natural cellular signals, are we fundamentally altering the way our connective tissue ages over the span of decades, simply because we're trying to control our reproductive cycles?
Wow. When you silence the natural biological rhythms and just force the body to operate on a static synthetic baseline for 10, 20, or 30 years, what kind of structural house are you really building for your future self?
Yeah.
It is absolutely something to think about the next time you push your body to adapt, heal, or grow. That is our deep dive for today. Keep asking the hard questions. Keep looking at the underlying blueprints of your health, and we will see you next time.